Before going towards ototoxic drugs, we need to learn about some terminologies. So let's start. What is ototoxicity? Certain medications can damage the ear, resulting in hearing loss, ringing in the ear, or balance disorders. These drugs are considered ototoxic. Hearing loss is a reduced ability to hear sounds in the same way as other people. Deafness means when a person cannot understand speech through hearing, even when sound is amplified. According to American Speech Language and Hearing Association, there are more than 200 known ototoxic medications, prescription and over-the-counter medicines, on the market today. These include medicines used to treat serious infections, cancer, and heart disease. Hearing and balance problems caused by these drugs can sometimes be reversed when the drug therapy is discontinued. Sometimes, however, the damage is permanent. Drugs known to cause temporary damage include salicylate pain relievers, aspirin, used for pain relief and to treat heart conditions, quinine, to treat malaria, and loop diuretics, to treat certain heart and kidney conditions. Aminoglycosides like streptomycin, gentamicin, kanamycin, tobramycin, amikacin, cicimycin, netilmycin, neomycin, framacetin, causes irreversible ototoxicity. Macrolides like erythromycin, roxithromycin, clarithromycin, azithromycin, spiramycin, causes ototoxicity. Vancomycin is an antibiotic which also causes ototoxicity. Anti-cancer drug like cisplatin and carboplatin causes permanent damage. To stay up to date, make sure to subscribe to our channel. Thanks for watching.